KEYNOTE-189 was a large randomized phase 3 study evaluating the addition of pembrolizumab to chemotherapy of pemetrexed and a platinum in patients with metastatic non-squamous non-small cell lung cancer. In this trial, over 600 patients were randomized to either pembrolizumab with chemotherapy or chemotherapy alone. The initial results of this study were first presented at AACR 2018 and simultaneously published in the New England Journal of Medicine. And what the initial results showed that there was a significant improvement in overall survival as well as progression-free survival with the addition of pembrolizumab to chemotherapy. At this year's ASCO, we provided an update with a longer follow-up. So the initial follow-up was under a year when the initial results were published and presented. Now we have a median follow-up of almost 2 years. What we looked at was overall survival, progression-free survival, and a new endpoint, a planned exploratory endpoint of progression-free survival 2. That is progression-free survival on second-line therapy or death in patients randomized on this study. And of course, we looked at if with longer follow-up we found any additional safety signals. And what we found with the longer follow-up is that the addition of pembrolizumab to chemotherapy did continue to show improvement in overall survival, now with a hazard ratio of 0.56 that translated into a median survival of 22 months with the addition of pembrolizumab to chemotherapy as compared to 10.9 months in patients who received chemotherapy alone. So there was almost a doubling of the median survival. In addition, at 2 years, we found that 45.5% of the patients were alive in the arm that received pembrolizumab plus chemotherapy, whereas it was 29% in patients who received chemotherapy. So there was almost a 16% improvement in survival at 2 years.